Dani Gasparini, and welcome to this segment of Penn Voice. I am joined today by Dr. Dick Gregory, who is the director of Apple Tree Dental Care, which is a nonprofit organization. So I think, Dr. Gregory, what we need to do is sort of explain to our viewers this kind of structure and your purpose.
Thank you, Dani. And I'd like to start by thanking you and Penn TV for the opportunity. I think this is a great community resource.
Thank you.
And I'm happy to be able to take advantage of it.
We do too.
I am a dentist. I come from private practice over 30 years. And I now, after retiring from my private practice, I'm working in public health dentistry and have been participating with Apple Tree Dental, which is, I'm excited to tell you, a new and innovative dental practice, unlike anything else in California. We just opened a San Mateo center in the fall of last year, and we're seeing private patients from around the Bay Area right now. Apple Tree is an independent nonprofit, and that's really what sets it apart from other practices. It's designed to deliver a highly personalized and patient-centered experience, and it's different from other practices in that we have specially designed equipment and services that also allow us to treat patients that wouldn't otherwise be treated. And that would include older adults in skilled nursing facilities, children in Head Start programs, the ones that have difficulty or find it impossible to get into private practice model, the way I used to practice. So,
now, are they typically an uninsured individual, or they do have some insurance?
Yeah, think about it as a barrier to accessing care. So there are a lot of barriers to care. The biggest one is cost, as you were suggesting. But there's also mobility. Older adults or children, aren't independent often and can't get to the private practice dentist, or even another dental center. So Apple Tree has a unique ability to go on-site and deliver care.
So you're mobile.
Exactly. And that's what I meant by some of the innovative equipment. We have designed the ability to do comprehensive dental services at a school, at a skilled nursing facility, at a group home where special needs patients would otherwise, again, not have access.
So does an individual who might have special needs, either developmental disabilities or just are bed-bound, they're not able to get to a facility, do they call you and you bring, or do you typically structure a visit with an organization like a senior home, and you go there and treat all of the patients?
Both. Both. We have the capacity to do both. So we could send...
Which makes you highly unique in the sense that an individual can be treated as well as a group of individuals.
As you might know, dentistry is very expensive to deliver. It's very equipment intensive, and that means it costs a lot of money to deliver care. So delivering that on site is not profitable. The other aspect of the Apple Tree model that makes it unique is the profitability, if you will, of treating private patients with insurance and the ability to pay allows us to treat other patients that would not have access to care. So we think of it as a buy one, give one almost. There's other examples of that in the industry. This isn't unique to Apple Tree, but it is unique in healthcare, I think. Tom's Shoes is the one that comes to mind for me, where you buy a pair of shoes and Tom's will provide a pair to somebody who needs them. In this case, for example, if a patient had a cleaning or a filling done, that would enable another patient who otherwise wouldn't have access to receive the same treatment on site in a facility away from the dental center, or at the dental center. We're one of the limited number of Denti-Cal providers, for example.
And you had mentioned earlier you have a physical location in San Mateo.
We do.
And then what is the geographic boundaries that your mobile organizations will travel to?
We can deliver services within about a 50-minute drive radius. So although the Bay Area has a high concentration of need and facilities, I don't think that we'd really need to go to that length. We can provide services in San Mateo County, certainly, San Francisco, Santa Clara County, and parts of probably 6 or 7 other counties in the Bay Area. We're focusing right now on San Mateo County because our funding comes from the 2 healthcare districts and the local Burlingame Rotary Club, and they have a responsibility, a fiduciary responsibility to their constituents and their residents. So we're focusing on services within those 2 healthcare districts.
Well, and San Mateo County also funds, the county itself funds a dental clinic.
It does.
So tell us how you're working with them at Fair Oaks Center.
We aren't working at Fair Oaks Center, but we actually, personally, I've been involved with the San Mateo County Oral Health Coalition, which was created by the Board of Supervisors over 20 years ago, originally to address the needs of children in the community. I was the chair from 2009 to 2014, and my focus was to expand that focus to all people in the community that weren't receiving care, particularly older adults, because that was my personal interest. Since that time, we've brought together a lot of key stakeholders, including the county, and we all contribute to, actually, right now we're working on a strategic oral health plan for the entire county, and that should be published in April. The hard work starts then, which is implementing a plan like that, but it really requires that everything's on the table and everybody's at the table to bring to bear all of our resources and our technical abilities to solve some of these problems.
And I understand that Apple Tree Dental is one of the only nonprofit structured dental organizations.
It is. It is unique. It was started 30 years ago, actually, in Minnesota. The dentist, the founder CEO, Michael Helgeson, was also interested in geriatric care because he recognized that they had problems getting it. And he was aware of the Mayo Clinic model, which is also a nonprofit and clearly does a great job of providing medical services. So he thought, why not apply the nonprofit model to dentistry and open up possibilities that a for-profit model just can't achieve.
Right.
So that's what Apple Tree Dental is doing these days, is with the advantages that a nonprofit allows, an independent nonprofit particularly, we can literally go anywhere and treat anyone in the community.
So tell us very quickly about the spectrum of care that you're granting. Proactive care with cleanings, but then also reactive care in the sense that you're doing fillings, and what's the spectrum of things that you're doing?
When I say comprehensive care, I mean anything that you or I could have as a patient in a private practice dental office, state-of-the-art equipment, can be done on-site in any of these remote settings if the space is there. And so we, for example, I would go to a skilled nursing facility, contract as the dental director with that facility, much like the medical director, and provide services to patients that wouldn't otherwise be able to have them.
So can you do replacement of teeth and denture work and things like that? Because I think one of the things that, just from personal experience, we sort of forget at our aging population that actually their oral health and the structure of their teeth are the most important, because that allows them to eat, and we sort of forget that part of aging.
We do. In fact, this has taken so long to implement, 4 or 5 years, that I was able to go back and get a geriatric fellowship at UCSF, and I'm even more aware than I used to be about the limitations that older adults have in accessing care, and end-of-life issues that we tend to sweep under the rug or overlook.
Well, we're very excited that Apple Tree Dental is existing in San Mateo County, and thank you for the work that you're doing. We're out of time, but we are going to post up how people can get a hold of your organization at the end of this segment. I want to thank you, Dr. Gregory, for being part of Penn Voice and telling us about this wonderful service that we have for all of our families in San Mateo County. So
thank you very much, Dani.
And we'll see, thank you. And we'll see all of you next time on Penn Voice.